Thank you both, Katrina and Annette. We are now going to start taking questions. I see we have some coming in, so please do send them. If we don't get to all of them, we'll be able to follow up with you by email following the webinar. So I think this there's a question just about psychological safety. So just to provide some more context to why psychological safety. So I think the terminology around psychology is really because the concept is around what an individual believes. So it's very possible that on a team would say 8 people, some people feel psychologically safe and others don't, right? So it's really focused on that sort of individual level belief. But I think from a what do we do about it perspective, what's encouraging there is that there are strategies, as we've heard from Annette and from Katrina, that we can do. So for leaders, for other people interested in supporting these kinds of discussions, so there are strategies we can do to create spaces which feel psychologically safe for more people. And so for leaders and others interested in these conversations, I think these are some things to consider. So we heard Katrina talk about the importance of reflexivity. So really providing process guidelines. And I think some of the examples we saw from Annette are really those kinds of here's how you do these things. Providing tools, which again, Annette mentioned. I think in our experience with this initiative, we're just in the process of doing the initiative evaluation. And that's one of the things which you heard loud and clear, which is other organizations we've been working with would really like some very practical tools to support their work. And then also you know, collecting information on how those changes are going. So really collecting that process data and making it part of just how you function, right? So making reflexivity just part of everyday practice. And I think these are very concrete things which we can all take and implement in our work in different ways, right? And adapting them to our own context. So there's a question, and then I'm going to invite you to start us for the response here. The question is, I wonder how we can efficiently and more responsibly demonstrate the value of equity work and changes. So is there anything you can share based of your own experience and work?
Great. Yes. Um, I think that there are some ways of kind of making more visible the impacts of this work and really doing some cost analysis and in particular cost savings analysis. So in one of the slides, I was showing the ways in which we, for example, developed a measurement tool, which is really just a brief patient questionnaire about some meaningful aspects of care from their point of view. It differs quite significantly from some conventional kinds of patients' experiences of care items. And we are working with that to try to be able to produce a brief glimpse into patients' experiences of care that would really be held out as a barometer for the impact of equity-oriented approaches on their experiences. And ultimately, what we would want to show is that if there's improvements in some aspects of patient outcomes, then that is, of course, our end our end goal, and that has all sorts of cost savings in terms of recidivism and people coming back over and over for their chronic pain, etc. And so there's a lot of things in between that, though, in terms of patients' experiences with care and seeing the impact on health outcomes. And I think that the more that we can work together to show that this is meaningful for patients, that it improves staff's own sense of work satisfaction, and that there is less incidences of, say, sick time from the moral distress that many people feel, that there's different ways at the organizational level
Thank you for that.
to reveal
So
the kinds
we
of
have time for one
efficiencies
more
that
question. And
ultimately can
Katrina, I'm going to invite
arise
you to get
when
us
you
started
bring
here.
care in
The
alignment
question
with
really
what people
is,
need
who's
and what they
best
want to
placed
deliver.
to lead
So I
conversations
hope that
around
offers
stigma,
a little bit
recognition,
of a glimpse into
decolonization? Is it
how
better
we
for it to be
can
done by
counter
colleagues,
this
or
argument
is it
that
better
it's
to
not
hire, say, a professional who
efficient
doesn't work
to
with
do
who
effective
doesn't work
care.
in the organization, or some sort of mix of both?
Yeah,
Any thoughts there?
it's a great question. And I think my answer sort of unsatisfactory answer will be it depends. I think it really depends on the type of work and the type of environment. So, for example, um, I think that they're within a small team, a team that knows each other relatively well and that works together and has a sort of an existing degree of trust amongst the team, and a team that already has articulated an equity intention. I think that can probably be facilitated by someone who has some facilitative skill and expertise and some background and training that has given them some um, capacity to at least understand issues of power and privilege and be able to feel comfortable in hosting that kind of a conversation. So, in those sort of more established teams that know each other and there's some trust already, that might be just fine. And then if it's more of a mixed group, where there's not the same degree of established trust, or where you're trying to spark dialogue about equity intentions and just begin, then it can be really powerful and helpful to have someone who's quite neutral to come and join the team. And again, that person has to have the right kind of mix of facilitative expertise and knowledge to be able to support that conversation.
Great. Thank you so much for that response, Katrina. And I'd just like to take a minute to thank you both for joining us today and sharing your knowledge and expertise. And I'm just going to offer up that both Annette and Katrina and myself will be happy to answer any further questions you have. As we leave you today, we just want to encourage us to think about what is your piece of the pie. So we're talking about really complex issues, which are so multidimensional. I believe very strongly that in all our work, there's something which each of us can do. One of the things I heard Annette say often as we were preparing for the webinar is, low cost. So the things which you can do which don't require you rethinking your entire budget, but which we can all do on our own. So as we leave here, just encouraging us all to reflect on that one thing you can do in your own practice. So thank you all so much for joining us today, and the recording will be available on the website following today's webinar. Take care, everyone.